I want to go back to a pressing domestic matter. In just a few weeks, the COVID-era Obamacare subsidies are set to expire. Now, as a part of the deal struck with Democrats to reopen the government after its 43-day shutdown, congressional leaders agreed to hold a vote on extending these subsidy programs, these subsidies for the Obamacare program, that are not only extremely costly, $1.5 trillion, that's with a T, but also compel taxpayers to continue underwriting abortion coverage and transgender medical interventions. Joining me now to break this down and give us the latest is Suzanne Bowdey, editorial director and senior writer at the Washington Stand. Suzanne, welcome back to Washington Watch.
Thanks, Tony.
All right. The FRC Government Affairs team has been busy communicating with Senate offices on the Hill regarding this issue. What seemed to be a non-issue now is front and center, and we could very well see a vote on this.
Right, and we've really gone from 0 to 60 in Congress. We went from nothing going on at all to now you have an avalanche of things happening. And at the forefront of that, now that we've moved past the shutdown and the Epstein files, is this crisis the Republicans have known is coming for a long time. I mean, I think you talked to a lot of them. They would have predicted in 2010 that we were careening toward a cliff where this program was concerned. And right now, the problem is there's a December deadline for these subsidies. And because Congress was out, because of the shutdown that Democrats thought they could use to jam Republicans into extending these subsidies, we're at a real inflection point in Congress about what we do. And our government affairs team has been on the Hill, as you said. They've been fanning out across offices. While there was a shutdown, they were able to meet with a lot of members and staff. And just reiterate, the most important thing about the health care program, whichever one we coalesce around, is that it does not include abortion or gender transition procedures funded by taxpayers.
I know we've talked a lot about this, but I also know that you've got to talk a lot about things for people to really grasp what we're talking about. These subsidies, in large part, they were done during COVID,
right?
But they really were a way to prop up a failing system.
Exactly. It was a Band-Aid. So Republicans knew that their system was failing. And the one thing they knew they could do to keep it afloat was to throw more taxpayers. Democrats.
Because
yep.
Republicans have never voted for this.
No, they not one time have they voted for it. But Democrats just thought, well, if we keep throwing money at this, if we keep shoveling taxpayer dollars, we can prop up the system. We can put a Band-Aid on it with these subsidies. And what's happened is the Band-Aid's being ripped off, and we're seeing the gaping hole behind it.
So what is going to happen in December when these subsidies expire?
Well, what's happened now, as a result of the shutdown, Republicans did agree to hold a vote on extending the subsidies. Now, there are some moderate Democrats who are a little squishy on this. They come from blue states. They want
Republicans.
Republicans. Sorry, I'm really getting my parties
blue,
confused.
Blue, red,
yeah,
okay.
Purple. But the purple ones, the Republicans, are a little squishy on this issue. They seem to think, well, we've been giving these constituents some free health care, some subsidies that have helped pay for it.
Well, and we're also coming into an election year.
And we are. And really ripping away a program like that is not something that you want to tell voters, I'm sorry, we're taking away the money that we're using to fund your premiums, which could double, as we know, if these subsidies aren't extended.
So this is a pressing matter.
It's a very pressing matter.
So there's going to be a vote, and as you've just described, there could be some Republicans, and there will be Republicans, and you don't have to have many in the House, 3, to pass something along those lines. So what Family Research Council has been working on is to ensure the underlying Obamacare, which is at the heart of the issue, is that it will not fund no longer fund abortion or transgender interventions, which it has been doing.
Right, and this is not controversial. As recently as January, the Marist polling company asked Americans, do you want your taxpayer dollars to fund abortion? 57% said no, and 41% of those were self-described pro-choicers. This is not a popular policy to funnel taxpayer dollars to abortion.
Well, even more so on the transgender surgeries.
Oh, absolutely, and you're looking at a 70 to 80% issue where Americans are concerned. It's not health care to kill an unborn child. and it's not health care to mutilate perfectly healthy children.
So, folks, there is a petition that we have going to Capitol Hill, to the leadership, to the House and Senate leadership, and you can be a part of that. Simply text ACA to 67742. That's ACA to 67742, and I will send you a link. Now, at the same time, there are members, and we're working with some of them, to provide a long-term solution to a failed system of Obamacare, working back toward the private care, the private health care system.
Exactly, and handing more power back to patients and to plan holders. And that's something that President Trump, along with a lot of Republicans, are floating right now. You see in the House and the Senate, there are plans being created that would invent a sort of a healthcare savings account, which would be tax exempt, and it would allow patients to choose their care.
But also protected by Hyde to ensure that tax dollars are not...
And that's what FRC is most concerned about. We want to drive down costs for patients. We want people to have control over their care and choose their doctors.
But you don't drive down costs by aborting babies.
You don't. No, you raise costs and you create disaster in your wake.
All right, so folks, text ACA to 67742. That's ACA, the letters ACA to 67742, and you can sign that petition. Obviously, this is going to be something between now and the end of the year that's going to be coming to the forefront.
And we should be grateful that there are House and Senate leaders who are with us drawing bright red lines where these issues are concerned.
Suzanne Bowdey, thanks so much for joining us.
Thanks, Tony.